I'm thrilled to be here to give you a guided tour of what we're doing in public health that pertains to women's health. Let's get started. I'm going to talk to you about how long we've been doing this kind of work, which is a long time, and it'll become evident why that's valuable. Show you some megatrends in women's health across the life course, many of which you've heard about today, but which connect to our work in public health as well. Some focal areas of groundbreaking women's health research at the moment in the Herbert Wertheim School of Public Health, and then where the road leads. I wanted to just get a show of hands. How many of you know of Elizabeth Barrett Connor? So not so many. And how many of you can attest to this quote at the top? A self-described pathological optimist, Barrett Connor was as deeply loved as she was fiercely regarded. How many have personally experienced that? Okay. We don't want to forget Elizabeth. She no first annual symposium of women's health at UCSD should occur without us acknowledging the incredible work of Elizabeth Barrett Connor during her career. So some of the megatrends, which I'll just quickly go through, U.S. maternal mortality is worsening. And this slide shows that overall it's gone up over the years 2018 to 2021. This is totally unacceptable that in the United States of America, we are going in the wrong direction on maternal mortality. In the country of Great Britain, a husband or a man, a partner, has a greater chance of dying during his partner's pregnancy than the woman herself. But this is our country. And these race, ethnic differences that you see here are a topic of great concern. You may say, well, it's social determinants of health that cause this difference by race, ethnicity. And so Dr. Bandely and one of our doctoral students has a paper coming out in Obstetrics and Gynecology Online showing that in the SOMI study, if you limit the population to women physicians, we see this exact same pattern. So we need to understand why women still die in childbirth in our country and turn this around for sure. Marnie Jacobs already talked to you about the many ways in which early life pregnancy complications are associated with increased risk of chronic diseases. And this slide shows all the different chronic diseases that she mentioned. I won't go through them again, but they're cardiovascular and diabetes and heart failure, stroke, all over the place here. So this limits, these pregnancy complications have been the focus of a lot of work in public health these last 10 years, I would say. And we know that because this life course factor affects our later life risk of chronic disease, it's also life limiting to have had these. You may have noticed that there's been a lot of talk about menopause in the news, on Oprah, on your social media feeds. This is a recent paper in Maturitas showing social media posts related to the menopause. I'm guessing one of these peaks, we are blue, actually, the USA. I don't know what's causing these peaks in the UK, but our two countries have the most talking going on. And the talking seems to be saying, look, doctors don't get enough training in how to handle menopause, so women are undertreated. They seem to be saying that women don't understand what this is. How many of you women, how many of you had your mothers talk to you about their menopause experience? So that's good. That's good. Keep talking to her. And so we wanted to do something about this situation. Increases in life expectancy have reversed in our country for both women and men. And you can see this persistent differential, which Dr. Brubaker talked about. We don't understand why women live longer than men, or we have lots of ideas about it. You can also see that we've lost ground due to the pandemic that we have yet to make up. Things are looking a little bit better in 2022. But who knows? This for us is a big vital sign of health in our country, and it's going in the wrong direction. And then this is a slide to set up Dr. Banks, who will give you a quick talk on her efforts to deal with menopause in older women. And so this graph shows age-adjusted death rates for the top 15 overall causes of death in 2023. And for every cause of death you see on this slide, men die at a higher rate than women, except for one. What is the one? The one is Alzheimer's disease. This is a big problem, and we are doing a lot at UCSD to tackle this problem in a variety of ways. And then finally, I just wanted to point to that the fact that surviving to old age with a history of cancer is greatly increasing, and that is a good thing. That means that all these cancers are not an instant death sentence, that women are living to be into their 80s with a history of cancer. And when you look at 2022, something like 36% of women have a history of cancer, and that's projected to increase to over 40% in the population of women who are fortunate enough to reach the age of 85. So there's this burgeoning increase in surviving to old age with history of cancer. And we want to do something about that because cancer survivorship in women is not the same as if you didn't have cancer, at least for many women. So here's a whirlwind tour of some of our School of Public Health healthy aging studies. I first want to mention, I was the PI of a national network of clinical trialists. We did 5 clinical trials, including one on GSM in vaginas, and with study of the vaginal microbiota, lots of papers from us on that. We wanted to make sure that we hadn't done all these trials in vain and had women not learn anything from what we learned. In addition to all of our colleagues and all their work, Irene Sue helped develop this website. You're welcome to go peruse it. There's a lot of opportunities to improve it. I'm having it rebuilt right now at UCSD to modernize the technology behind it using my own discretionary funds. This was NIH-supported work, and I would welcome collaboration to update parts of this website, to add treatments that women are using, for example, cannabis and CBD. There's nothing in the website about that. I would welcome, we're in the process of responding to reviews to publish a randomized trial. We did completely online testing mymenoplan.org against reputable menopause websites for outcomes like knowledge about menopause and intention to change treatment, clarity, things like that. So please take a look. I don't get to play any tapes for you from this, but it's an important tool, digital tool, evidence-based, unbiased, no drug company money, so that women can have a place to go. And we thought that would be replaced because there was a congressional law, at least passed by the House, I don't think it passed both chambers, to do a bunch of things to improve the state of menopause care in our country, including developing a comprehensive website. But I'm just guessing that's not going to happen anytime soon. And so our website has become important for another several years, which is why we're going to invest in making it the best it can be. So can we predict longevity is another area of research in the School of Public Health. And in particular, we're also interested in not just longevity, survival to advanced ages like 90, 95, 100, older than that, but are you surviving in good shape without physical disability and without cognitive disability? So the difference between the B and C groups here are the duration of experiencing functional limitations physically or cognitively. The B, these people are living longer. Women tend to live longer, but we also have more functional limitations than the men. And then the A group here is a group that died earlier. So I've been a PI of the Women's Health Initiative I've been involved in the Women's Health Initiative since 1992. I showed up to my first meeting pregnant with twins, and my babies are 31 years old now. So this study, we recruited, thanks, that's perfect. We recruited almost 162,000 women from across the United States, and we did the recruitment from 93 to 98. And now we're still following them, and we have thousands of women who have died. We have thousands of women who are still with us, and we are able to study. We have thousands of women who had the opportunity to survive to age 90, 95, 100, which means that we have this natural experiment, which is not replicable in any database, including the UK Biobank, because we can compare women eligible to survive to a given age to women who were eligible but didn't make it, and with and without all these different functions intact. So one of my doctoral students who's graduated, Purva Jain, published this paper in JAMA Network Open looking at some of the early epigenetic clocks in relation to healthy longevity. So on the left here, we have the odds of surviving to age 90 with intact mobility at the top, and with intact mobility and intact cognitive function on the bottom. And then on the right, we have survived to age 90, but your physical function was not intact. You had compromised mobility, and on the bottom, compromised mobility or compromised cognitive function. And what you can see with these early clocks is we were able to show that they predicted survival to age 90. And they predicted it both with and without intact function. And that's probably because they were all trained using machine learning and AI on phenotypes that didn't include cognition. So an important direction is to get to training some of these epigenetic clocks, including the things that we want to see maximized in later life. This is my colleague, Aladdin Shadiab. He is associate professor in the School of Public Health and in geriatrics and medicine. Well published. He has led the way on our longevity studies in the Women's Health Initiative. And he's been on the faculty for, 4 or 5 years, and got 2 big R01s in the WHI, one focused on epigenetics and one focused on proteomics. And so we've got a huge amount of data now on these 2 types of omics. And I have to speed along, but this is data that are unpublished, that are accepted for presentation at the AAIC meeting in Toronto this summer. And you can see we're now up to like 16, 17 clocks. And they also, just like the earlier work by Purva Jain, this DNA telomere length one goes in the opposite direction because we want longer telomeres. Everything else is age acceleration. We want lower age acceleration. So these all go in the right direction. They're mostly statistically significant. The later clocks have a stronger association than the earlier ones. And there's not a material difference in how well they predict these 2 separate phenotypes, survival to age 90 with preserved cognition versus without preserved cognition. But we can make this happen. We have the data to figure out how to predict survival to age 90 with preserved cognition, which is obviously the only way I want to survive to age 90 if I get to do that. I wanted to say something about our many physical activity studies. I've had 2 R01s in this space where we used accelerometers to measure physical activity and sedentary behavior. Both were funded by NHLBI. The second one's still going on. And what we found here was that accelerometer measured physical activity predicts all these different cardiovascular outcomes. And we showed for the first time in older women that even light physical activity, which would not register, it's very poorly measured by questionnaire, is associated with a reduced risk of cardiovascular disease. Also, steps per day are super interesting, and I'm going to illustrate how we deploy some of these analyses by introducing you to Dr. Nguyen, who's a postdoctoral fellow on the cusp of joining our faculty. Steve, are you out there? Yeah, there he is in the back. And he is studying why is it that physical activity is associated with a reduced risk of Alzheimer's disease and dementia, especially using proteomics. So that's it. I have Sherry Hartman here too. If you want to do a study on behavior change, these slides show that Sherry knows how to change behavior. And she's with us today. And if you want to know the outcome of this study, you have to go to Grand Rounds. These are 2 unpublished papers, but I wanted to make you aware of them. And then back to Elizabeth Barrett Connor's Rancho Bernardo study. These data are freely available, and Donna Kritz-Silverstein is someone you can contact, but you can also just go to the website here, nitucsd.edu, and download any data that you want. There's a lot of it. And then finally, Linda McAvoy, who's an emeritus professor, is the PI in Seattle now of the Adult Changes in Thought study, which is also an awesome cohort study I've been involved with since I was a young woman. So thank you very much, and enjoy the rest of the day, and thanks for having this wonderful conference.